Hi, I am Dr. Kristine Kiat. I'm a board-certified pediatrician, and in today's video, we are going to talk about childhood asthma. In this video, I will discuss what are the possible triggers of asthma, what are the signs and symptoms that you should watch out for that might indicate that your child is having an asthma attack, how doctors diagnose asthma, what are the treatment goals, and what can you do to prevent this condition? And more importantly, watch up until the end of the video because I will talk about action steps on what you can do to help your child. All right, enjoy watching. Childhood asthma. Asthma is a condition wherein the lungs and airways become inflamed when exposed to certain triggers. So it causes symptoms in your child that might interfere with play, school, sports, and sleep. If left untreated, it might lead to dangerous asthma attacks or periods of difficulty of breathing. So the symptoms of asthma can be triggered or made worse by certain allergens like pollen, dust mites, and pet dander. It can also be triggered by common colds and other respiratory infections. A known trigger is secondhand cigarette smoke, as well as air pollution. Other triggers of asthma also include activity or exercise and extremes of weather. So, what are the signs that your child might be having an asthma attack? First off, he or she might be coughing. Secondly, you might hear a wheezing sound. It is a high-pitched whistling sound that you hear when your child exhales. Also, he or she might be having some trouble breathing, or there is a tight, uncomfortable feeling in the chest. He or she might also experience fatigue from lack of sleep. You might also hear complaints like, "My chest feels funny," or "I'm always coughing." So you also need to recognize if your child's asthma is getting worse. And this is by watching out if the symptoms happen more frequently, like in a week, how often does he or she have these asthma attacks? Is it waking him or her up from sleep on most nights? And does he or she need to use the rescue medications more frequently? And you need to note if it interferes with the regular activities, like is he or she missing school a lot? So it might be signs that your child's asthma is getting worse. This is a table the doctors use to characterize the severity of asthma. So what are the signs that your child is having an asthma emergency? If there is gasping for air, if your child is having trouble breathing where you see the belly being sucked in, and if your child is having trouble speaking or cannot complete full sentences, and lastly, if you see the nostrils widen from breathing so hard. So how do doctors diagnose asthma? We need to obtain a full history and physical examination. We'll ask about how often your child is having symptoms. Does it wake him up from sleep? Does he need to use the medications more frequently? Does it interfere with the day-to-day activities? Also, we need to take note if there is any family history of asthma, allergic rhinitis, and eczema. Also, of course, we need to focus the physical examination on your child's lung and do a full physical exam. Your doctor might also need to do a blood test, which may look for signs of infection. The doctor might also request for a chest x-ray if there is a need to rule out other conditions like a pneumonia. And the doctor might also request for an allergy test if your child has allergies. Another test, which is done in children 5 years old and up, is a breathing test that measures the airflow in your child's lungs. Treatment goals for asthma. The main goal is to treat airway inflammation, and this is done through controller medications or preventer, which are given on a daily basis to prevent asthma attacks. Another set of medications are rescue medications or relievers or quick relief medications, which are given during an asthma attack. Another goal is to minimize and avoid asthma triggers. And lastly, another goal is to maintain normal activity level so that child can enjoy play, enjoy sleep, and minimize absence from school. The doctors used a stepwise approach in treating asthma. For example, your child is on a daily controller medications and has been stable for a couple of months on it and hasn't been having any asthma attack. The doctor would then step down on his treatment where the doctor might reduce the dose, or it is also possible that the doctor may take off your child from controller medications. And then, for example, your child is on a daily controller but is having more frequent asthma attacks, more needing the rescue medications more often, then the doctor would step up his treatment by increasing the dose of the controller. What are the ways that we can prevent asthma attacks? First off, we need to limit exposure to allergens. So by avoiding triggers, like if your child's frequent trigger is an upper respiratory infection, getting a yearly flu shot can help. Also, you need to prevent smoking around your child. Um, an infant who is exposed to secondhand cigarette smoke during infancy is a strong risk factor for asthma. Also, you need to keep your child active. And lastly, you need to keep your doctor's appointment and have regular checkups to follow up on his or her asthma. Action steps. So, these are the steps that you need to do right now to help your child's asthma. First off, you need to have an asthma action plan for your child. It is a piece of paper, and your doctor can help you with this. It's a piece of paper that you can use at home and share with family and friends. It contains vital information such as emergency contact information. It also contains what are your child's asthma triggers and your child's usual symptoms. And what are your child's medications? What is the dose and the timing of when to give it? It also contains instructions about what to do and where to bring your child during an asthma attack. Also, you need to keep an asthma diary. It contains information about your child's symptoms, and if ever your child is having any symptoms, did you give any rescue medications? And then what is the response to the medications? And are there any side effects? And also, you need to also take note, is your child sleeping well? Thirdly, we need to avoid triggers. So, no smoking around your child. Prevent upper respiratory infections by frequent hand washing and getting a yearly flu shot. In terms of dust mites and pet dander, you need to keep your house free from those. And lastly, ask your doctor if it is advisable for your child to get a peak flow meter. It is a handheld device that measures your child's breathing ability. And when the numbers go down, your child might be having some trouble and would need to be seen by the doctor. Okay, that is the end of our video. I hope you learned a lot. Thanks for watching. Hi! I hope you enjoyed the video. I am here to provide support and help you raise happy and healthy kids. If you have any questions or if you want to suggest a topic, just type in the comments below. And don't forget to hit like, subscribe, and the bell button to keep posted. Alright?